For the election, you said, yeah, we're going to win a majority government, but were you even surprised by how well this actually went?
Look, really proud of the campaign that we ran. I mean, we said all along the slate of candidates we had was so impressive. I was so proud of the slate of candidates all across this province, and that wasn't just a political soundbite. That was, I sincerely was so proud of the candidates we have, and I was really proud of the team and the vision we laid out for Nova Scotians. And I knew that it was resonating with Nova Scotians. I knew that from listening to them on their doorsteps. So you never know what's going to happen in an election, what the people are really going to decide. But I had confidence that they had confidence in what we were presenting to them. So I'm really pleased with the results.
Mr. Houston, you ran on a platform focusing largely on health care, and you did say last night that this is not a problem that can be fixed overnight. I'm just wondering if you can talk about where do you start? What happens, I guess, first to start tackling this massive issue? Yeah,
thank you. I mean, we start right with Dr. Strang in public health. Obviously, we have to be focused on public health first and foremost. So I did have a chance to speak to the public service and Dr. Strang already this morning. I intend to meet with Dr. Strang and his team in person later today in Halifax. So we focus there because there's Nova Scotians all across this province that are really anxious about back to school. They want to know what the plan is for back to school, and we want to make sure that they understand the plan and they're confident with it. So we'll meet with Dr. Strang. We'll talk about back to school. We'll talk about vaccines. We'll talk about the fourth wave, but that's where we start. We had a focus during the campaign. That focus is even stronger right now. We want to make sure people can access health care in this province. So that'll be our focus.
How long will the temporary rent control measures remain?
Excuse me. These are all important questions. I know the distress that people are feeling from so many different areas. So we have a transition team in place, and Scott Armour McRae will lead that transition team. And we'll be focused on a lot of things, but we want to make sure that there's a smooth transition. That's what Nova Scotians want. That's what Nova Scotians expect. We'll be working with the other party leaders and every Nova Scotian really. But we'll sit down with the transition team and we'll just talk about a lot of issues. There's a lot of challenges in front of this province, but there's tremendous opportunities. So things like rent control, things like just public health in general. Those are the types of things we want to make sure there's a smooth transition, that we always put Nova Scotians at the front.
So right now, the idea was the rent control measures would stop when the state of emergency stops. Are you prepared to say one way or the other about that?
Yeah, no, I've been very clear that I understand and sympathize with those people across this province that are in rental situations and are worried about making rent. I understand that. I grew up in a family that was renters, so I've understand it completely. I do not believe that rent control is the solution to the housing crisis in this province. So we're going to continue to focus on solutions that actually make a difference. That means increasing the housing stock, and that means working with Nova Scotians to make sure they have affordable housing. That's our focus. So I haven't changed my opinion on rent control overnight.
And about affordable housing, would you be adopting the recommendations of the Affordable Housing Commission?
Yeah, for sure. I mean, anytime a government puts Nova Scotians together in a commission or otherwise and asks them to look at a challenge, then the government should respect their findings, and I certainly respect the findings of the commission.
Hi. What's your reaction to Erin O'Toole saying he will cancel the Liberal affordable childcare plan and replace it with a tax credit program?
Yeah, childcare is. I mean, this is something else. It's it's a stressor for a lot of families. It's keeping a lot of people out of the workforce. We know that. So we're going to work with the federal government on solutions to the issue. So whoever is, work with the Prime Minister or work with anyone who wants to help Nova Scotians on a number of issues. Healthcare has been our #1 focus. We need a partner in Ottawa to help us fix healthcare. And we'll be focused on partnering with Ottawa on a number of things. Childcare is one of them. Healthcare in general is one of them. So there's, I'm actually very optimistic and looking forward to having a good relationship with the other premiers across this country and the Prime Minister on a number of issues facing Nova Scotians.
And how do you feel about the HRM removing people from tents in public parks where they've been living all summer?
Housing's in crisis. We know that housing crisis is very real. It didn't develop overnight. It's been developing over 8 years. We didn't have 10 cities 8 years ago in this province. We have them now, so we need real solutions for housing. I understand the significance of the issue, and we're going to work with people to make sure that people can access housing.
Well, what would you do for the people who have been removed from those tents?
You know, look, we're going to get the transition team together. There's a lot of issues that we want to work through with them, and we want to make sure that we get the briefing notes and we really understand all the moving parts. But I think that I think in the bigger picture, and I've been very honest with Nova Scotians, there's a lot of challenges in this province. I do not have a magic wand. They didn't all get fixed today because there's a new PC government, but I want them to know they will get fixed because we are focused on them. They're going to take time. There's lots of them, but we're focused on fixing them.
Thank you.
Sorry, 3 questions. Sorry,
Okay,
because
no
I'm
problem.
pinch hitting for some other folks. I do want to focus on the housing issue again, just in terms of the individuals who are being forcibly removed from tents. I'm just wondering, on principle, if you agree with that kind of approach or what you would rather see to be done.
I think it's incredibly sad that we have people living in tents in downtown Halifax and other areas across this province. They need suitable housing. Tents are not the answer. So we're going to focus on finding solutions to the housing crisis that work in the long term.
This also goes to kind of the urban-rural bit of a split in the vote in the election, and I'm just wondering how you plan to run the province without significant representation from urban areas. How do you balance that compared to your strong rural vote?
No, listen, we're going to work with all Nova Scotians on the issues, regardless of where they live. I will respect every voice in this province. I will listen to every voice in this province, and I think when you look at the slate of candidates that we ran across the province, we had great candidates across the province, rural, urban, everywhere. So we're going to listen to Nova Scotians, and I'm not concerned about our ability to govern the province as a whole. We're very focused. I live in a rural area. I grew up in Fairview, and there's lots of my colleagues in the legislature that have the same lived experiences.
Shifting to public health, I understand you do have to meet with Dr. Strang, but there have been several ideas bandied about the Scotia Pass, for example, maybe looking at bringing back restrictions for New Brunswick because it has case numbers increasing, mandatory vaccinations. I've wrapped a lot into this question, but where do you stand on those kinds of measures?
Same as I always have. I mean, we're going to listen to public health. We're going to work with Dr. Strang and his team. We're going to get all the information and make some common sense decisions. I'm also looking forward to working with the other provinces and having a good relationship with our neighboring provinces in particular. Sorry, I'm losing my voice. Better now than 2 weeks ago, I guess. But we're gonna work with public health. I want to be very, very clear with Nova Scotians. The public safety of Nova Scotians is my primary concern. We will make decisions that keep them safe. We will make those decisions based on input from public health and based on input from any other source to make the best possible decisions to keep Nova Scotians safe. That's my focus. That's the focus of our team, and that's the focus of Nova Scotians. That's why it's our focus.
Thanks. You want to fix healthcare, but I haven't heard what you want to do first. Like, what would be your priority?
Well, you haven't heard what I want to do. We've been talking about it for 30 days. But we put out a very detailed plan on what we think is possible in healthcare. It includes things like a pension plan for patient-facing physicians. It includes things like extending the time that operating rooms are, working with surgeons to make sure they can clear the backlog. It includes things like investing in long-term care, 2,500 more single rooms, hiring more healthcare professionals, getting more doctors, nurses, CCAs, all of those things. And what we're going to do to make that happen is work with the people on the front lines. We will be meeting with doctors. We will be meeting with nurses, meeting with CCAs. We'll be meeting with anyone who has ideas on how to get healthcare to a point where Nova Scotians can access it when they need it. So we're going to work with Nova Scotians. So the very first thing we're going to do, obviously we talked about, I've already met with Dr. Strang, and I'll meet with him again today in person, and his team. But we'll meet with doctors. We're going to meet with healthcare professionals on the front line to make sure that the solutions we put forward work for them. If we can make them better by listening to them, we'll make them better, because we are very focused on making sure that people can access healthcare in this province. We will not stop until they can.
So is that what Nova Scotian will see in the first year? Consultation, dialogue? Will there be any action, any other action?
Yeah, they're going to see a lot of action. I'll judge myself on my ability to make sure they can access healthcare. It's not overnight. It's not overnight. It's going to take an investment. I want to be very clear with that with Nova Scotians. But certainly, as this first mandate progresses, people will see improvements. And I will consider that we are starting to make progress the day I'm walking down a street somewhere in Nova Scotia and somebody stops me and says, I just got a doctor and I'm so happy. Or the day somebody stops me and says, my loved one, my friend, finally accessed the addictions and mental health support they need. Or somebody stops me and says, I was waiting months for my surgery and I got it. And now I'm back to work. That is when I will consider we've made progress. And I won't stop until all those things happen.
So when you say healthcare fix is going to take time, do you see this as something that can happen in one term, or?
I mean, certainly the standard that I will judge myself upon is that there's significant progress in access to healthcare in the first mandate. That's the standard.
And the funding for the healthcare fix, will that affect other programs in government?
No, I think we were very upfront on the investment that's required. We actually started putting out fully costed platforms, very detailed, a full year ago. A full year ago, we put out a fully costed platform for Dignity to Seniors. Back in the fall, we put out a fully costed platform on universal mental health care. And then in January, we put out a fully costed platform on primary health care. Early in the campaign, I think it was the first week of the campaign, we put out a fully costed platform. And then supporting documents to show people how we arrived at that have been fully accessible. So listen, we're going to, this province is going to run deficits for a few years, and we've suggested that it'll be 6 years. We're not interested in moving this province backwards in any way. We're only interested in moving it forward. The investment we have to make is because it's been neglected for 8 years. Like, that's just the reality. When you sleepwalk through a doctor shortage, and when you pretend that healthcare is not in crisis and fail to invest in it, the person that comes along behind has to have the courage to make those investments. These bills that we're paying are already sitting on the table. We're just saying to Nova Scotians, you can have confidence that we, as a PC party, as a new PC government, have the courage to pick them up and deal with them. And that's a message that Nova Scotians have said very clearly to my candidates. Have heard it, our candidates have heard it, I've heard it. They find it refreshing, because we've done politics differently from the start. Just by being so honest about our fully costed platforms and putting so much information out there was a refreshing change for most Nova Scotians. But also, you know, a lot of times the new government comes in and says, gee, we didn't know it was so bad. No, we've been upfront. It is bad. It's going to take money. The neglect has to be, you know, we have to change course in healthcare. We're going to make the investment. So I'm not, we're going to run deficits. I'm a long way of saying I'm not looking to cut any other services to fund this. It's just we have to be there for Nova Scotians. We have an obligation to make sure they can access healthcare, and I take that obligation very seriously.
One last, I know this is day one, but any idea when we might be back in the House?
Yeah, look, the transition team, I'm very proud of the transition team led by Scott Armour-McRae, and there's a lot of issues to work through, including when the legislature will sit. That's one of them for sure, but I will tell you this, it won't be a full year before the legislature sits like we've seen in this province.
You just spoke about running deficits and did say that you're not going to be cutting services in order to fund healthcare. Last night in your speech, though, you did mention the need to make some tough decisions. I'm just wondering if you can elaborate on that. What do you mean by those tough decisions?
Well, there'll be a lot of tough decisions in a lot of areas. I think I've been asked about a couple of them this morning, about the removal of people from tents, about the housing, rent control. These are decisions that have a very real and very quick impact on people. And any decision that you make that has a very real and dramatic impact on people is a tough decision. And I know there'll be lots of them.
And in your platform, you mentioned the creation of a department for addictions and mental health. Is that going to happen right away with your first cabinet?
Yeah. So again, with the transition team, and as we kind of work with the public service and certainly work with the other leaders as well, but with the transition team, making sure we have a smooth transition. That'll include a swearing in of cabinet, and there will be a minister dedicated to addictions and mental health in that new cabinet when it's sworn in.
And one other thing you did talk about a lot throughout this election, and even before, was the need for fixed election dates, given that Nova Scotia is the only province that doesn't have it. So now that you're going to be forming government, are we going to see right away in legislation to implement fixed election dates here in Nova Scotia?
It's certainly, it's my intention to actually select the next election date pretty soon. I thought about it, I did, was set up a working group to make sure that every Nova Scotian could see their place in government, but certainly in the PC party. And I'm very proud of the work that Betty Thomas did on that committee. We attracted certainly the most diverse group of candidates we had, and I'm very proud of those candidates. I share in their sorrow that we didn't win them all, but certainly it's my intention to continue to make sure that every Nova Scotian sees themselves in our government, but certainly in the structure of the PC party, and we'll continue to work on that. So we made some great strides. When you look at the quality of the candidates, we had good people that had the courage to put their name forward, and we'll continue to work in that direction.
I also want to ask about what changes you plan on implementing, specifically in mental health care.
Yeah, mental health it's something we've been focused on as a party for a couple terms now. Really, it's a passion of ours because we understand the need. So our universal mental health care plan that we put out in the fall, we're gonna act on that for sure, and that includes a separate department. But it also it includes making sure that all of the resources of this province are mobilized for the benefit of Nova Scotians. So that means working to open up the billing codes so that anyone who's trained to provide support to a Nova Scotian will be able to do so, and you won't have to have money in your pocket to get services, which too often happens now. It should be free, it should be accessible, and that's our focus.
Thank you.
Thank you.
That, and it's my fault, I packed a lot into my last question, but specifically about the Scotia Pass, will you consider a Scotia Pass at all?
Yeah, I mean, this is something that came up in the last week of the campaign. I thought it was pretty. I thought it was pretty sad how it came up in the last week of the campaign. It was a clear kind of political stunt that played on the emotions of Nova Scotians in a very strong way. I'm not interested in tugging at the emotions of Nova Scotians, and certainly not for votes. So it was unfortunate that it came out that way. What I am focused on is making sure Nova Scotians are safe, making sure Nova Scotians have confidence that their government is doing everything to keep them safe. So I will work with Dr. Strang. We will meet with Dr. Strang later today. I've invited the other leaders to be part of that, so we can have an all-party committee to make the very best decisions. But back to school plan, vaccines in general. Fourth wave, these are all things that we're going to work with Dr. Strang on to make sure we make the best decisions to keep Nova Scotians safe.
So does that mean there's no yes or no right now?
No, it means I need guidance from the experts. It's not a decision I'm qualified to make. I need input from the experts. I don't have that input from experts right now, but I'm anxious to get it.
And will there be an all-party committee to deal with COVID? Are you convening something like that?
Yeah, we've made that offer. We've invited the other leaders to be part of the meeting with Dr. Strang. This is not something that I think should be politicized. I think it should be just everyone pointed in the same direction, and that direction is keeping Nova Scotians safe.
Throughout the rest of the pandemic, go work with all
Yeah, no,
parties
I'm
for COVID?
certainly open to that. I mean, we made the offer for today. We'll see what the uptake is on that. But for me, it's just, the best decisions for Nova Scotians. That's the focus in healthcare, in the pandemic, in every issue.